Welcome to channel. In this video we will talk about Iran and other countries. Iran reported its first confirmed cases of SARS-CoV-2 infections on the 19th of February where, according to the Ministry of Health and Medical Education, 2 people died later that day. Early measures announced by the government included the cancellation of concerts and other cultural events, sporting events, and Friday prayers, and closures of universities, higher education institutions, and schools. Iran allocated 5 trillion rials to combat the virus. President Hassan Rouhani said on the 26th of February 2020 that there were no plans to quarantine areas affected by the outbreak, and only individuals would be quarantined. Plans to limit travel between cities were announced in March, although heavy traffic between cities ahead of the Persian New Year now use continued. Shia shrines in Qom remain open to pilgrims until the 16th of March 2020. Iran became a center of the spread of the virus after China during February. Amidst claims of a cover-up of the extent of the outbreak in Iran, more than 10 countries had traced their cases back to Iran by the 28th of February, indicating that the extent of the outbreak may be more severe than the 388 cases reported by the Iranian government. By that date, the Iranian parliament was shut down, with 23 of its 290 members reported to have had tested positive for the virus on the 3rd of March. On the 12th of March, the Human Rights Watch urged the Iranian prison authorities to unconditionally release the human rights defenders detained for peaceful dissent, and to also temporarily release all the eligible prisoners. It stated that there is a greater risk of the virus to spread in closed institutions like detention centers, which also lack adequate medical care. On the 15th of March, the Iranian government reported 100 deaths in a single day, the most recorded in the country since the outbreak began. At least 12 sitting or former Iranian politicians and government officials had died from the disease by the 17th of March. By the 23rd of March, Iran was experiencing 50 new cases every hour and 1 new death every 10 minutes due to coronavirus. According to a WHO official, there may be 5 times more cases in Iran than what is being reported. It is also suggested that US sanctions on Iran may be affecting the country's financial ability to respond to the viral outbreak. The UN High Commissioner for Human Rights has demanded economic sanctions to be eased for nations most affected by the pandemic, including Iran. Now we will talk about Europe. Confirmed cases of SARS-CoV-2 infected people in relation to the population of the country, cases per million inhabitants. 6. The numbers are not comparable, as the testing strategy differs among countries and time periods. As of the 13th of March 2020, the World Health Organization (WHO) considered Europe the active center of the pandemic. Cases by country across Europe had doubled over periods of typically 3 to 4 days, with some countries, mostly those at earlier stages of detection, showing doubling every 2 days. As of the 17th of March, all countries within Europe had a confirmed case of COVID-19, with Montenegro being the last European country to report at least 1 case. 634. At least 1 death has been reported in all European countries, apart from the Vatican City. As of the 18th of March, more than 250 million people are in lockdown in Europe. Now we will talk about Italy. Civil protection volunteers carry out health checks at the Guglielmo Marconi Airport in Bologna on the 5th of February. The outbreak was confirmed to have spread to Italy on the 31st of January, when 2 Chinese tourists tested positive for SARS-CoV-2 in Rome. Cases began to rise sharply, which prompted the Italian government to suspend all flights to and from China and declare a state of emergency. An unassociated cluster of COVID-19 cases was later detected, starting with 16 confirmed cases in Lombardy on the 21st of February. On the 22nd of February, the Council of Ministers announced a new decree law to contain the outbreak, including quarantining more than 50,000 people from 11 different municipalities in northern Italy. Prime Minister Giuseppe Conte said, in the outbreak areas, entry and exit will not be provided. Suspension of work activities and sports events has already been ordered in those areas. On the 4th of March, the Italian government ordered the full closure of all schools and universities nationwide as Italy reached 100 deaths. All major sporting events, including Serie A football matches, were to be held behind closed doors until April, but on the 9th of March, all sport was suspended completely for at least 1 month. On the 11th of March, Prime Minister Conte ordered stoppage of nearly all commercial activity except supermarkets and pharmacies. On the 6th of March, the Italian College of Anesthesia, Analgesia, Resuscitation and Intensive Care, SIAATI, published medical ethics recommendations regarding triage protocols that might be employed. On the 19th of March, Italy overtook China as the country with the most coronavirus-related deaths in the world after reporting 3,405 fatalities from the pandemic. On the 22nd of March, it was reported that Russia had sent 9 military planes with medical equipment to Italy. As of the 12th of April, there were 152,271 confirmed cases, 19,468 deaths, and 32,534 recoveries in Italy, with the majority of those cases occurring in the Lombardy region. CNN report indicated that the combination of Italy's large elderly population and inability to test all who have the virus to date may be contributing to the high fatality rate.
Press the bell icon on the YouTube app and never miss another update.